This week, we are training our school clubs and their patrons on sexual reproductive health and rights. Young people, both in and out of school, face very many sexual reproductive health challenges. For example, we see that a lot of girls, very humble backgrounds, miss up to 4 days of school due to menstruation.
When they are menstruating, some of them used to use soil as pads. But now, when they come together and do a session like this, they help their friends in making pads. These pads are being made locally so that they don't get affected.
Sexual reproductive health is very important in schools.
Most of the children who have been getting pregnant early, that is the teenage pregnancy, it is mainly because they did not have proper sexuality education and they're not well sensitized.
People have been hiding some information from younger adolescents, but we have seen that it has been a big problem. Some of them, they have been tending to look for their own information and they make their own research.
I have a simple message I like to pass the adolescents concerning menstrual hygiene management. There is a lot of stigma which runs around in your communities. Like some girls have been told that when their menstruation, they can't go to school.
Many of the young people actually engage in unhealthy relationships. As a result of that, we see that quite a number of them actually end up getting pregnant.
In my club at school, we usually have meetings and we get to talk about a lot of issues, and I think that would be the best time for me to tell my fellows about what a healthy relationship really is, how you identify one, and how to act when you find one.
And many of them also end up actually getting into early marriage.
Simply because they are not sensitized and they do not have the information around them.
My plan for educating people about this and inform them that these misconceptions that they're having are wrong, because so many people want to leave drugs but don't know where to go. Then we're going to give them that space and tell them that you can leave drugs. We're going to give them an assurance.
If we could take this information in a proper way and guide the students in a proper way, they would actually do better.
And to be able to address that, we think that empowering them with age-appropriate sexual reproductive health information is very important.
So as a patron, I believe this is going to be a great opportunity for me.
And according to the way how we are being trained here, the major message is
to sensitize them, to educate them. I believe with this program, I'm going to be able to equip them with some life skills that I've learned here. I'm going to be able to guide and counsel them.
And that's why over 1 week, we are gathered here with the hope that they're going to use this information to be able to support their peers in school so that they can actually live very healthy lives and eventually stay in school, complete, and eventually become very successful people.
Enabel, an organization that is equipping we, the adolescents, with the skills of being good peer educators, exemplary.
I'd like to thank Enabel for this great opportunity of giving us to go through this reproductive health education. As a teacher in the Busoga region, mainly to the boys' school, I really appreciate this opportunity.